In this episode of 360, we continue our look at some of the unique ways in which we deliver curriculum to our students. While all BSN programs have standard educational requirements, we're looking at what makes the Duke nursing program special and why DUSON is a school like no other. One of those special qualities is the unique personalities that help deliver content and bring curriculum to life in a variety of interesting ways. Melanie Bunn is just such an example and a showcase of the exceptional education delivered at DUSON. She also shows how Duke nurses become leaders in their field. Jill Brennan Cook is one of the faculty members who teaches the course. She says that Melanie is an expert in Alzheimer's disease and the specialized care it requires. But more than that, she's an exceptional educator, the kind that makes curriculum come alive.
And she's a renowned expert in communicating with people that have memory impairment. And she embodies the person and is almost like a theater class where she interacts with the students and has them acting out scenarios and practicing little tricks on how to communicate effectively with people that are confused or people that are angry and just have some memory impairment and they're so confused and angry and frustrated.
Melanie is an expert in Alzheimer's disease and the specialized care it requires. But more than that, she's an exceptional educator, the kind that makes curriculum come alive. Melanie brings the experience of dementia patients to students in ways that builds empathy and understanding. She's a nurse practitioner who's worked in geriatrics since 1983, both in hospitals and long-term care facilities. She's also involved with program development and education for the Eastern North Carolina chapter of the Alzheimer's Association.
I actually am a 1993 graduate of Duke University School of Nursing. I was in the very first gerontological nurse practitioner program group. So it's really good to be back home to talk with students about something which is critically important, because in all settings of care, in all settings of healthcare, in all settings of life, in all types of places where older people are or where people are, we're seeing more and more people with dementia. People with dementia are high users of health care, and they don't have the ability to change the way they do things. So what we as clinicians need to find a way to do is to change our approach. And so what I've tried to do here is to give students insight into the impact their behavior has on people living with dementia.
Bunn specializes in what are commonly called difficult or challenging behaviors. In other words, the person living with dementia is acting and speaking in ways that create challenges and frustrations for the care provider, or present physical or psychological risk. But according to Melanie, a bit of understanding can help students become better caretakers and provide their patients with a better experience.
So I've tried to help them develop some skills in changing the way they start an interaction, in the way they engage and connect with people. Because with people living with dementia, what really makes a difference is that connection. What really makes a difference is giving them a moment where they don't feel isolated and estranged. Because people with dementia, we talk so much about people losing memory and language and the ability to monitor and physical abilities and function. We talk so much about that. And we don't talk enough about the sense of feeling like they're isolated and they're on their own. Like there's nobody who's on their side. And what people with dementia critically need is that feeling that they've got somebody who's on their side. And who is in a better position than a nurse to be the person who is connected, who's on that person's side, who advocates, who understands it from their perspective, and then changes the world around them so they can be successful. Because when they become successful, their care is better, their outcomes are better, and our lives are better as well, and our society is actually a better place.
Bunn's teaching is part of a team-based approach that includes family members and other informal care partners to provide better care to their loved ones. It's also part of the comprehensive approach DUSON takes to delivering nursing education to the highest standards and beyond. It's all part of how we bring curriculum to life at DUSON. We hope you'll check back for our next episode, when we'll travel to Duke's Nasher Museum to learn more about how students are engaged in innovative learning